All right, I think everything's set. Welcome, everyone. Welcome to an ONA event. And we are also going live in our support group. And welcome for everyone tuning in this evening. Our topic today is Bloods Unveiled and what to ask your doctor. And this is a common discussion in our clinic at ONA in Essendon about how to carry out this conversation with your GP about what bloods you would like to request, why you would like to request them, and how to navigate through this conversation in a calm and professional manner, no matter how it goes. And the reason why we decided to present this webinar is because it's an ongoing conversation. And for everyone listening, you may relate going to a doctor and getting nowhere. You may relate to this story of, oh my goodness, I am not feeling myself, or I want to get to the bottom of what I'm experiencing, or I am focused on a particular goal. Let's say it is to do with enhancing fertility or supporting your ovulation or understanding more about your hormones so you can make the changes. And guess what? This sometimes goes poorly, and what we experience on our end as practitioners in our field in Chinese medicine, our patients come to us feeling disheartened. Or the most common saying is, my doctor said everything's great. Until we dig a little bit deeper and we'll look thoroughly at the tests. So I'll talk to you more about what happens next and how to really empower yourself through this conversation. So, first of all, we have a bunch of knowledge that we want to be able to share with you. So, ONA has not always had this particular part to what we have to offer. And we stepped away a little while ago now, and we really dug deeper. We went deeper into the knowledge of Western medicine and what it has to offer, because we never really wanted to discredit this part. We always wanted to have a holistic and balanced point of view. So yes, we love Chinese medicine, but we went that little bit more in depth in terms of what Western medicine has to offer and looking at the numbers of the blood tests. So we really educated ourselves and put ourselves through an intensive education where we can integrate the point of views. So here it is. Here is the blood card. And if you're not seeing the blood card on this live, that's okay. All you have to do is comment below and we will send you a list of bloods to ask your doctor. And if you're on a webinar, you will be seeing a list that we usually ask our patients to communicate to the doctor about. So let's have a look at this list. I want to talk through it because there are clues about what it is that we're looking for in terms of your health. So you can see it's quite a list, and usually if you don't say anything and don't give your doctor any direction, usually they'll do something like the full blood count, the maybe the lipids, which is inclusive of cholesterol, maybe iron studies. They may or may not do the electrolytes, and they may or may not do inflammatory markers depending on your symptoms. Your reproductive hormones, they may not even go as far as that. If you mention that you are trying to conceive, some doctors, they do a measure that's called AHM. And this is a hormone that indicates your reserves. It's not one of my favorite tests because it creates this hyper focus about urgency and creates this perceived timeline for a woman. and sort of being at either wherever it lands really for that particular woman, but it could be towards a lower end or middle, higher end, and it creates urgency and anxiety. So really, if we do see this number on a test result and it's the only measure of hormones, we will ask for more information. Okay. So then the other thing that they may look at is folate. Some doctors are more nowadays ask for vitamin D, and that's about it. We very rarely get thyroid function, for example. And if we do, it's bare minimum. And we rarely get a full panel of hormones to indicate what is going on. Sometimes over here, we've got under the reproductive hormones, we've got a recommendation to go to day 2 to 3 to a doctor and request or get the actual pathology done. Or you can do a hormonal test on day 21. Both have different bits of information, which we'll go into a little bit more later on. But we, yeah, we don't see that as a norm. Doctors don't really do that. Okay. Also, I feel like doctors feel that, and I may be wrong, but maybe not every doctor, but I feel like doctors feel like that's not their special area. So, but they may be more proactive to refer a female to a gynecologist or an obstetrician or a fertility specialist to discuss those tests or to perform those tests. So straight away, you can start visualizing there's a bit of a journey to get some answers. It's not just one person, it's now maybe 1, 2, maybe 3 people by the time you get to a specialist. And each time you enter a specialist office, you have to retest because they may need other specific things. So that's why we have a thorough list to communicate. The other reason that we have a list is that as acupuncturists, we cannot write a prescription. So we have to liaise with general practitioners. Okay. So here's the list. Feel free to take a snapshot. If you are working with us, we will be sending you this. If you're not working with us, we're happy to send you this list. So all you have to do is communicate if you would like this, and we will send it your way. Okay, now next. What happens when you step into the doctor's office? I think going prepared for a conversation is going to be a very much more of a productive use of your time than just hoping for the best. And I will put my hand up. I've been in that position before where I just trusted the system and I came in feeling positive and open and trusted that the doctors will do the right thing. And unfortunately, in my personal experience and many patients that have come our way, this is not always the case, like I said before. Some of my experiences have been complete rejection of what I'm hoping to see and look at. Sometimes confusion in terms of what I'm asking for and why I'm asking for. And sometimes outright bullying in terms of what I am in the right to ask for and not to ask for, which is confusing for me as well. So I'm hoping for you not to experience this and give you some tips and tools how to not to be in that awkward situation where you're fighting your GP for some blood results. Okay, so today we're going to walk away with a strategy. Okay, so we're going to understand how to navigate through this conversation and also why some of the blood tests are important so we can prioritize some over others and how to then bridge the gap. Okay, so would that be good if we walked away with a strategy knowing that even if they don't request all of the tests, we have some actions that we can take afterwards, and it still doesn't add too much running around to your day, okay, and collecting the information. I think there are 3 keys, and one of them is the main key to achieving this. One is an awesome relationship with your practitioner. And I believe that at ONA, we have an awesome relationship with our patients, and we are there to back them up and guide them, jump on the phone with them, and talk them through if they need any of our help, okay, to the best of our ability. The second key is doing your homework, empowering yourself, understanding why it's important, understanding the reason behind it, so then you can communicate clearly. And the last key, and I think most importantly, communication, okay? So communication is going to be your strongest suit. So let's see how this conversation can go, okay? How you can communicate. And a lot of the time it goes something like this. You step into the doctor's office, the doctor asks, how can I help you? I would like to get some blood results tested. This is what I would normally say. And here's the list. And you hand over the list from ONA. Here's the list of what I would like to cover. And the doctor usually would say, oh, I see. And what is the reason for these tests? Okay, so because we haven't flagged why we have come into the office, we're just asking for the tests. That is not unreasonable question. So we're going to provide a little bit more information here. Look, doctor, I'm wanting to understand how to get into an optimum state of health, and I need help with these tests. I have not been feeling my best for the last X amount of months, let's just say 6 months. And I would like to understand a little bit more about what's going on within my body. So then, of course, naturally, the doctor will get curious and ask for symptoms. And you can provide top 3 symptoms that are major symptoms that are relevant to you. Okay. This will drive what test the doctor will be willing to go ahead with. So if we go back to this list, we've got electrolytes, we've got liver function, we've got iron. Excuse me. So we've got electrolytes, liver function, iron studies, lipid studies, full blood count, which we'll talk about hemoglobin. We'll talks about the folic acid, ferritin, so all the iron studies, and also I believe encompasses renal function, like protein markers, that kind of thing, urea. So all of that should be encompassing, okay? Vitamin D, calcium, magnesium, inflammatory markers. Inflammatory markers include things like ESR, CRP, homocysteine. So those markers are going to be important for us to see what's going on and where the pressure is in your body. And then reproductive hormones, this is when you are trying for a family, which includes FSH, luteal hormone, progesterone, and estrogen on day 2, between 2 to 5 is usually okay. And then if you're looking to see if you are ovulating, we do another test to measure progesterone and estrogen on day 21. Then it's also really good to have a look at testosterone and the SHBG to see your energy levels and how much drive, how your libido is going, how well you're ovulating as well. B12, folate, and homocysteine I've mentioned. Homocysteine for inflammatory markers. So we really want to highlight as many of these as we can. Now, if your symptoms, to figure out your top 3 major symptoms, if your symptoms are very subtle, we need to be strategic here, okay? For the doctor to look deeper into your tests, there has to be a symptom that will grab their attention and also allow them to understand that you are serious, that you are experiencing some difficulty and need more information. So it's good to frame what's going on. Perhaps you are trying for a baby, and perhaps you've been trying for quite some time. Maybe you can say, "I've been trying unprotected sex for 12 months now with my partner, and with no luck." So, of course, they're going to look at reproductive hormones if we talk about that. If we talk about energy, energy for the doctor might mean vitamin D, it might mean iron, it might mean looking at other hormones like testosterone, maybe B12, folate. So it's really important to talk about energy if that's the case for you. Do you feel other symptoms, things like hair loss or thinning, or maybe there are difficulty breathing or palpitations? It's definitely worth mentioning, maybe even feeling dizzy. And this will allow your doctor to think outside the box and go towards tests like thyroid panel, liver function. So they will start to make the connections, even vitamin D. They don't always test it, definitely more often than before. Than years ago, they never used to test vitamin D. I still come across a test that he's missing vitamin D, and I'm like, this is the greatest thing that we can have a look at, and tells us a lot of information. So let's have a look of what could happen next. So you've given them the symptoms, and I think it's really clever to say something like, "Look, doctor, I realize that you may not be able to do all of these tests. And if you can do as many as possible, that would help me so much." Now, I've been in situations where I've fought my doctor for results, and usually it doesn't go too well, and it adds more to do to my list. And it just takes energy. It takes, you know, you'll leave the other person feeling awkward and stressed, and you leave yourself feeling awkward and stressed. So let's not create that situation. We want to be understanding. To help you understand what may be going on the doctor's side, is that they have some regulations and restrictions in terms of how much testing they can do per individual. And they have some regulations for each person. There's like a levy. And say, for example, you've tested a vitamin D this year and it's been close to a year, they may not retest that test again until 12 months has lapsed. However, you could say, to go ahead with that, and there may be some out-of-pocket fees. So it's good to have that in mind as a bit of a wild card, okay? So let's just say the doctor says, sure, I'll do as many as I think is appropriate, and they go ahead and they do most of them. That would be like the best case scenario. Now, what happens if they say no? Hold on a second, and the conversation goes in a different way. Let's just say the doctor has some negative remarks about the system, the medical system, and how you may or may not be using the system, or maybe they are restricted and it's not appropriate. And there's only so much you can say. Like, it's not in your control, what they do choose or do not choose to do within their limitations. So it's good to say, look, I am happy to cover any out-of-pocket expenses. I'm happy to cover it today, if we can do as many tests on this list as possible, please. The doctor may have some remarks. It's important to breathe. Okay, if the doctor is a little bit worked up on this end, breathe, stay calm, and remember we are working as a team. Okay, so we really want to get them on board to say, look, that's okay. Whatever is possible. So whichever ones you can't do, that's okay. That will suffice. But the rest would be amazing. Thank you, doctor. Okay. So usually they will soften up and they might ask you if you're working with a naturopath at that point in time. It's common. They might trying to understand why it is that who's needing to look at them and how you're going to be utilizing these tests. And you can say something like, I am working with a registered integrative acupuncturist. So keywords registered, okay? This is giving them an understanding that you are working with a professional who is under APRA on the board, and it is a regulated profession and that you're in good hands. And it's also nice to say, I find that I'm happy to connect you both so you can discuss my results together and so that I can get the best outcome possible. I think it's a nice sort of handing over a little bit of a leaf. And look, what we can do from our end is to go that little bit further and provide you a bit of a letter discussing what we're hoping to achieve and to thank your doctor for the time spent and the effort spent. So usually if we cover all those areas, the doctor will say, okay, and one thing that I recommend before you leave the office is to clarify the clinic, the practice policy on receiving the results. So some practices still are okay to receive a phone consultation or a tele, uh, a oh my gosh, the virtual consultation, and they are happy to give out the results via email. But some clinics and some practices have now really created a rule about rebooking an appointment, seeing the doctor face to face, and some really go to lengths to have special policies in terms of releasing the results as well. So it's good to understand where you stand and where the clinic is at in terms of releasing the results. So I would suggest asking, doctor, how do I receive my results at the clinic here? Can I receive them by email? Can I jump online with you to receive the results? Do I need to come in person? Or can we avoid doing that? You really just want to plan the journey for yourself and see how productive you can be and how quickly you can get the results. But definitely, you want to have the results in your hands in the end. Some clinics, especially if you go through a hospital, you will be able to access your results in a portal. And that's some people do have access to that and some may not. So like a Medicare portal where you can access your data. So this is the chat, really. It can go really well and positively, and we don't have to push it. And I know you're wondering, well, Anna, what if they didn't do all the results? Like, how are we going to get the optimum outcomes if they haven't given me what I wanted and what you wanted and what we're asking for? That is a good question, and let's have a look at the solution. So we recommend this platform, iMedical. iMedical is a portal online. They do all sorts of things in terms of like collecting blood tests for workplaces. And something that they do is private blood tests. So you can order your blood tests privately in just a few steps. So 3 easy steps, and you can see it here. Order your test, select what you want to order. Then print your pathology request, take it to the associated collection center, which they will disclose that. The prescription itself goes through a general practitioner on their end, and gets approved based on your age and sex and what you're needing. And usually there's no issue at all. I have not had any issues with iMedical except for minors. There may be some restrictions for people younger than 16 or 18. So some tests may be restricted for that reason, but usually there's ways to get around it and communicate with them. And then once you go to the collection center, within 24 hours, you'll get your results to your inbox and you don't have to chase the doctor. And we like to start with the GP because it will, in the end, save you costs. It will save you the funds that if we do go through iMedical, it can, if we follow the whole list, it can come up to anywhere between $300 to $400. So to minimize those costs, we want to go through the GP, get as much as we can through them, and then we can jump on iMedical and fill the gaps if we need to strategically based on the information we do have and any red flags that may come up in the tests from the doctor. Okay, so let's have a look a little bit further. What are the most important things? And look, I've listed these things, and it is difficult because everything on the list can be important for different individuals. But if we were to prioritize these are the groups of blood that I would be recommending. So for people who can't see the screen, I've got here cholesterol, vitamin D, so estrogen, testosterone, thyroid panel. Again, it will be restricted, and a lot of the time the GP will only order TSH, which is the thyroid stimulating hormone, and it's an overview of your thyroid activity, which may or may not give us enough indication. But if other markers are elevated elsewhere, we might want to look at thyroid further and get the hormones and the full panel and the antibodies. And then I've got electrolytes as well. So as my 6 priority tests, this is why it would be really important for us to look at those. Some of them interconnect, but cholesterol looks after your cardiovascular health, your vitamin transport. So, did you know that cholesterol, if we have sufficient amount of cholesterol in the body, it helps us produce hormones, but also moves vitamins around into our bloodstream to different parts of the body. For example, vitamin D, like fat soluble vitamins like vitamin K and vitamin D, they will be able to get to where they need to get to thanks to cholesterol. And digestive health is reflected in our cholesterol markers as well. Now, vitamin D is in charge of hormone regulation, bone density, immunity, cellular repair, mood regulation, muscle function, cholesterol regulator as well. The cholesterol molecule is interconnected with vitamin D in the body. So, and this production of vitamin D. So if we look at those, there will be a relationship on the blood test with those two. If one is out of range, the other will be reflecting and compensating for it. Testosterone for both female and male is important to have a look because it reflects our mood, hormones, libido function, ovarian function, estrogen, and in particular estradiol, which is E2, and it is gives us insight into glucose and insulin regulation, maybe even gives us a little bit of indication whether there is insulin resistance for women who may be experiencing patterns of PCOS, polycystic ovarian syndrome or symptoms. Lipid metabolism, so that's fat metabolism, and mitochondrial function, which is where our energy is produced in our cells, bone health, and mineral metabolism. So next, thyroid panel. If we have the whole panel, we can see things like weight. Why is the weight fluctuating? Is the energy being produced efficiently? Is fertility on track? Is your cycle irregular for that particular reason of thyroid being up or down, and whether your mood is stable or not. Even if there is autoimmune issues, there may be factors in the thyroid panel that flag autoimmune disorders. And I love looking at electrolytes. I never knew this prior to doing more education, but things like fluid metabolism, are we dehydrated or do we need more fluid absorption, and focus on that? How's our energy available? Whether it's actually happening inside the cell itself, or maybe there is adrenaline and it's hard to feel whether it's true energy or not. This is where we can get clarity. We can see habitual things in the person's electrolytes, even to how regular the meals are and how well the nutrients are entering their muscles and absorbing as well. So then, once we have the results, what do we do with them? Once we've gone through all the hoops and gathered everything, well, we do invite you to send it over to Team Honor. We usually print it out and look at the results thoroughly before you come into your next session. We'll sit down and discuss it with you and figure out the thresholds. And I want to touch base on the thresholds. You see, in the medical field, this is Western medicine, the thresholds are really wide. Okay, so let's just say vitamin D. They want the vitamin D to be up to 50, okay, between like 30 and 50. And 50 for us, it's just so low, okay? So they want, is it 50? 50 is, for them, is like the best. Okay, so it's like the top level. But for us, it's quite low because there's, so if we go back, vitamin D is in control of so much: hormone regulation, bone density, immunity, cellular repair, mood, muscle function, cholesterol regulation. Oh my God. So there's so much that vitamin D is in charge of, and 50 units in the bloodstream, it's like not much at all. For our holistic levels, we want narrow thresholds. So rather than looking at it, you know, minimum 50 and then maximum's like, I don't know, 80, then from memory, I think it's like 50 to 80. I have to check and quote it for you. But I'm so focused on the holistic thresholds, which are more narrow. And ours are between 120 and 150. That's like amples away from 50. 50 is like the minimum, the bare minimum, like to survive. You know, even in summer, 50 is low. But even if you're a little bit under 50, it's common that the doctor will just blow it off. May not even see or say anything or recommend any supplements. If you are, say, 51, they will ignore it. They will not even flag it with you. And very commonly, if your vitamin D is as low as 50, your cholesterol will be out. Your cholesterol will be higher. And then you walk away going, oh my gosh, I have to stop eating eggs and have less cheese. And, you start sort of getting worried about your diet. But the thing is, there is not enough vitamin and nutrients in there. And there's probably other factors that it's driving your cholesterol to go up. And maybe your hormones are in imbalance. There's this thread that links these tests all together and gives us a better perspective of how to really see you as a whole unit, not just you and I and you, not just you and your liver or like your cholesterol, you as all interconnected. How are these things talking to each other? So we'll sit down and we'll have a good chat with you about your individual situation. So, what can we tell you about your results? We will talk to you about fluid absorption. We'll talk to you about muscle energy availability. Are you absorbing your protein? Are you even having enough protein? Your inflammatory processes. Where is your inflammation? We'll combine it with our traditional diagnosis in Chinese medicine and back it by black and white results on your blood test. Your metabolism performance, whether you are actually low in energy and processes on the inside, whether your hormones need balancing, are you detoxifying properly, whether it's your body is able to do that for you well, your iron production and efficiency and absorption, your ovulation status, energy capacity, lifestyle habits. We can even see if you're fasting and not eating your breakfast. You know, we can see it all clearly and we can guide you and tell you, well, is this suitable for your body type or is it not? We can see if there is a change in your blood glucose levels, and whether you're building insulin resistance. And this is all really, really important for your fertility health. And it's one of my favorite topics these days because it makes people link everything together. And we'll go into a little bit of a Q&A in a moment. And one thing that I'm really excited is to sit down with couples, with their partners, and really go through this thoroughly. It's very likely that your general practitioner will not spend 45 minutes with you just looking at your tests and trying to link everything together. They will not do that. They will not even do that for 5 minutes, unfortunately. So we're here to guide you and understand what is the gap. What is your body telling you or not telling you? What is the subtle thing that we can change today rather than waiting for the threshold to change so the doctor has, you have your doctor's attention? By the time you get your doctor's attention, you might have to go into surgery or go into the emergency room or go on cholesterol medication or blood pressure medication. Why? Why are we putting ourselves at risk, especially as future mothers? Why are we putting ourselves at risk of gestational diabetes or preeclampsia or, my goodness, who knows what else? Post- Postnatal depression. Why do we neglect ourselves without really acknowledging what's in front of us? Why? I think partly is because there is this perceived urgency. And we think that if we spend longer to try and look at something, we will miss whatever it is that we desperately want for ourselves. But I promise you, if you don't spend a little bit of time looking at these things thoroughly, you are predisposing yourself to greater risk for your health, your baby's health, the quality of lifestyle that you deserve as a family. And I'm only talking to you about it through my own experience, through my own clinical experience and my own personal experience, because I'm going to tell you, your health is the most important thing. It's the most important thing because when it's not there, we really know it. And then somehow we forget, and then something happens and we remember until our health takes us and really shakes us up, and then we think, oh my goodness, I will do anything to have my health. So wouldn't you do anything to say the same for your future family? your baby, your partner's health, not just in order to get pregnant, but in order to enjoy your family that you're building, to run around with your kids and not be feeling like, oh my gosh, I just want to collapse on the couch every night. To be there, right there with them, growing, evolving, and pushing yourself to the next level. I've got beautiful patients that do surfing with their kids, and they do trekking and they rock climb. And, wouldn't you want to do that and have that kind of lifestyle? Play soccer with them, chase them, help them go faster and try and beat you rather than them beating you, you know? So this is why we wanted to put this to you as a webinar and really help you understand this important step of testing. It saves you time in the end. In the end, it saves you finances and it saves you energy and running around. It saves you your family health. And we can tell you, and a lot of the time, there's simple things that you can tweak. Okay, simple things and habits that you can tweak in your family home. Behaviors that are in your complete control. We want to be able to tell you what they are clearly, and you can see them clearly, and you make the right decision for you with a lot of clarity. So I can see a couple of questions coming through here. One of the questions is, are these tests fasting tests or not? Or can I eat before checking my tests? And that's a good question. Not all of them are fasting, but things like glucose will be a fasting test. So I would recommend to fast when doing your blood work, just to cover all bases. And things like B12, it's a special test. So that might take that little bit longer. So if your test is not ready in 24 hours, that usually just takes that little bit longer to process, maybe 2 to 3 days. So yeah, definitely fast, just to make sure. And also, your doctor might say you don't need to fast, but if we are doing some additional testing, then if that's the case, definitely fast, just to make sure we don't mess up the results, because it can give us different data. It may not be accurate, and then we've sort of wasted the opportunity to see the accurate results. And what else? So we've discussed what to ask your doctor. Good. Um, can I ask these tests from my specialist? Yeah, absolutely. If you're working with your specialist, and you can let them know that you're working with an acupuncturist or a team of acupuncturists who are integrative and they look at bloods, and you can share this list with them. A lot of the time, specialists also have their own systems and processes and their own supplements. We are so happy to talk to them and really be on the same page with all as a team together, in so that we can get the best outcomes for you with you in mind. Okay. Beautiful. Do I brush my teeth before the tests? Um, it's an interesting question. I don't see why not. I think maybe this question comes again from the glucose part, and sometimes there is sweeteners in the toothpaste. I use a natural toothpaste, so I don't have that issue. But if you're not sure, also again check with your GP depending on the test that you're doing. But if you're not sure, just don't brush your teeth in the morning. Get your blood test done and then brush your teeth afterwards. Um, yeah, I think it's to do with the ingredients of the toothpaste. Good one. Okay, and day 21. Yeah, so the difference between day 2 tests for hormonal panel for females and day 21. Day 21 is checking whether you have ovulated prior to day 21. And day two, between day 2 and day 5 of your menstrual cycle, we're looking at your estrogen, how your lining is coming along, the reflection of your hormones and the follicle development in your ovaries and how that's coming along, whether you've got enough estrogen or maybe too much estrogen and maybe it's dominating, which could be signs of your metabolism changing, for example, more weight around the mid region, maybe more inflammatory signs like breast tenderness or fibroids in the breasts. Maybe it's part of the reason why ovulation is delayed, and we can cross check with day 21 as well. So it's good to, if your doctor is very open and working with you, it's good to get those separately. So one prescription with everything, and then a separate prescription for progesterone day 21. And usually the doctor will know it's a separate test, just 2 pieces of paper, prescriptions, so that you can get them at different times in your cycle. This is for females only. And for males, you can get your bloods at any time. And yeah, I would say fast just to be safe before your tests for more accurate results. Well, we're going to be winding up. Thank you so much for joining us. And for those watching back, feel free to get in touch with us if you don't have a blood card available. Now, there is going to be a door prize. So I'm going to be pulling a lucky winner, and I will be notifying you for everyone who has registered for this webinar. I'll be notifying you, and you have the uh, uh, awesome opportunity to meet with one of the experts at Team Honor and discuss your blood results on the house. So for anyone who would like that, now if you're a returning patient and you might have your review coming up, we might be doing that exercise already. And maybe you're in maintenance and you're maybe not seeing us as often. This is a really good conversation to have with your doctor, and you probably know quite a lot about your blood tests by working with us. But if you're a little bit more new, this is a really good exercise that we can do at ONA, and you can go ahead and start having those discussions with your doctor. So hopefully this was a very informative and sort of casual webinar, but also easy to understand in terms of the next steps to take. And I'd love to know if you didn't have a chance to ask a question, please reach out. You can reach out via hello@naturalharmonytcm.com.au, or you can find us on Instagram and follow us and interact with us at ONA Fertility. We love DMs, and we love answering your questions, and we incorporate all your questions into education for others as well, and it will absolutely benefit people watching and reviewing. So thank you, and we'll see you next time. There will be this webinar will be back in about 6 to 8 weeks, so watch out for the next date. And our next event at ONA, it is a online webinar again, and it's all about men's health, so, and fertility and well-being. So if this is relevant to you and your partner, please be in touch with us and also register. The best way to register is to give us a call, text us, or DM us on Instagram, and we'll help you register. There's usually a small fee associated with these events to cover our admin support. And we like to extend a +1 for the 1 ticket, so you can bring a friend. Just let us know if you are wanting to do that, and we'll organize that for you. Thank you so much. Have a lovely night, and see you next event.